Foamy urine can look alarming, but one episode rarely proves kidney disease. A fast stream, dehydration, or toilet cleaner can create harmless bubbles. Repeated foam deserves more attention, especially with swelling, blood, or high blood pressure. Most single episodes are harmless, while a returning pattern deserves a urine test. The key is not how dramatic the bowl looks, but what repeats and what testing shows. Urine contains water, salts, and waste products. Bubbles form when air mixes into that liquid. Most disappear soon after urination stops. Foam lasts longer when protein or cleaning chemicals help hold the bubbles together. The 6 causes divide into 2 practical groups. The first 3 usually change the appearance of the toilet water. The last 3 involve protein or actual gas in the urine. That division helps separate brief observation from medical evaluation. One glance at the bowl cannot identify the cause because the surrounding pattern provides better guidance. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. The first reason is a fast or forceful urine stream. A very full bladder can release urine with enough speed to churn the toilet water. This can produce many bubbles for several seconds. They usually fade soon after the stream stops. The second reason is toilet cleaner or soap residue. Cleaning chemicals can react with urine and create stable-looking foam. Flush fully, then check a later sample in a clean bowl. A large change suggests chemicals contributed to that episode. Chemicals become less convincing when foam repeatedly returns in a clean bowl. One apparently harmless episode should not explain every later episode. Continued foam after removing cleaning products needs a different explanation. The third reason is dehydration. Less water makes urine more concentrated, darker, and sometimes more likely to foam. Morning urine can look stronger after several hours without drinking. A darker sample after heavy sweating or poor intake is common. Hydration should be reasonable, not forced. People with heart failure, advanced kidney disease, or prescribed fluid limits need individual advice. For most adults, thirst and pale yellow urine provide useful guidance. Foam that continues after normal hydration deserves evaluation. The pattern changes with the fourth cause because the substance is now inside the urine. Temporary protein leakage can follow fever, hard exercise, acute illness, or major physical stress. This does not automatically mean permanent kidney damage. Temporary protein may disappear after the trigger resolves. Tell the clinician about recent exercise, fever, or illness before testing. That information helps separate a short-term change from a pattern needing follow-up. The fifth reason is actual air passing with urine, called pneumaturia. It differs from bubbles created when urine strikes toilet water. A person may notice air, unusual sounds, or bubbling unrelated to stream force. Pneumaturia may follow a urinary procedure or catheter. It can also come from an abnormal passage between the bowel and bladder. Some urinary infections release gas. Repeated infections, abdominal pain, fever, or foul-smelling urine increase concern. The most important kidney warning may be the one you cannot see. Early kidney disease may produce no pain, swelling, or visible foam. A normal-looking bowl can therefore be more misleading than dramatic bubbles caused by harmless factors. The sixth reason is persistent protein leakage from damaged kidney filters. Glomeruli, the tiny filters in your kidneys, normally keep blood proteins inside the body. Damage can let albumin, a major blood protein, escape into urine. Larger losses can stabilize bubbles and make foam recur. Diabetes and high blood pressure are common causes of long-term kidney damage. Some immune diseases can also inflame the kidney filters. Foamy urine alone cannot identify the cause. Personal risk factors and test results determine the next step. This same kidney cause can look different because protein leakage is not all or nothing. Small amounts may appear only on a sensitive urine test. Larger losses are more likely to create lasting foam. The amount of leakage affects both what testing detects and what a person may see. The first decision is whether care can wait. Seek prompt care for visible blood, much less urine, shortness of breath, or rapidly rising blood pressure. New swelling also matters, especially with puffy eyelids, swollen ankles, or fast weight gain. Fever, burning, or pain in your side or back below the ribs may suggest infection or blockage. Passing obvious air with urine also needs evaluation. Pregnancy lowers the threshold for medical assessment. New high blood pressure with urine protein can signal preeclampsia, a serious pregnancy complication. Contact your pregnancy care clinician promptly for severe headache or vision changes. Upper abdominal pain or sudden swelling also needs attention. Without urgent warning signs, remove cleaning products and return to normal hydration. Observe 1 or 2 later samples under those conditions. Record pain, fever, swelling, urine color, and recent blood pressure readings. The practical threshold is whether the foam returns after those obvious triggers are gone. While observing, do not force large amounts of water or take unproven supplements. Extreme fluid intake may be unsafe for some people. Home remedies can also delay testing or distort the pattern. Arrange a medical visit when foam continues for several days or repeatedly returns. Testing should happen sooner when major kidney risks are present or after a previous abnormal urine test. Bring recent blood pressure readings and a list of medicines to help the clinician choose the right tests. At a clinic or laboratory, you may provide a clean catch urine sample. You clean the area and begin urinating before collecting the sample. This reduces contamination from skin or nearby material and improves the reliability of the result. Menstrual blood or vaginal discharge can affect the sample, so mention either before testing. The timing of the sample may also matter. An early morning sample reduces variation from daytime activity and changing hydration. A single spot sample is usually enough for albumin testing. A full 24-hour urine collection is not routinely required. A basic urine test checks for protein, blood, sugar, and signs of infection. A standard urine test strip usually detects larger amounts of protein. A microscopic look at the urine can reveal blood cells, infection cells, crystals, or other material. These findings help determine which additional test is useful. If burning, urgency, fever, or foul-smelling urine suggests infection, the clinician may order a urine culture. This test checks whether bacteria grow from the sample. The result can identify the infection and help guide treatment. A second test compares urine albumin, a blood protein, with creatinine, a waste product. This comparison is called the urine albumin-to-creatinine ratio. It adjusts for how concentrated the sample is and can detect smaller albumin leaks than a standard test strip. Albumin may appear even while blood creatinine remains normal. This means an early kidney filter problem can appear in urine before a blood test changes. One abnormal result still does not prove long-term kidney disease. Clinicians usually repeat abnormal urine testing to see whether protein leakage continues. They may compare later results with blood pressure, blood sugar, and blood tests. Persistence changes the level of concern. A blood creatinine test estimates how well the kidneys filter waste. Urine and blood tests answer different questions, so clinicians interpret them together. Current medicines may also need review because some can affect kidney function. One isolated episode after an obvious trigger can be observed. Repeated foam crosses the line into testing. Warning signs or pregnancy concerns change the decision from routine testing to prompt care. Bubble size never determines urgency by itself. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.